I am Dr. MOOSA, Senior Consultant Cardiothoracic and Vascular Surgeon, Meridian Hospital, Chennai. I have more than 35 years of experience in heart surgery and bypass surgery with good results. I am highly specialized in latest technique of bypass operation, what is known as beating heart bypass operation, or doing the bypass operation while the heart is working. Unlike the conventional bypass operation where we stop the heart during the procedure and connect to the heart-lung machine. In this beating heart technique, we are not stopping the heart and there is no need of the heart-lung machine support, so that the patient's recovery is faster, patient's complication rates are less, patient's post-operative pain is less, patient's hospital stay and ICU stay is less, and they can go home in 3 to 5 days time. So this new technique of bypass operation was introduced in 1997, and the first surgeon to do using the machine called Octopus is by myself while I was working as a senior consultant and chief cardiac surgeon for Indian Railway Headquarters Hospital at Chennai. Now we all know that heart disease are very common, especially heart disease causing the heart attack and blocks are increasing in our country, and it is affecting more and more young people in 30s and 40s in our country, unlike in Western world where it is more common in people after the age of 65 or 70. We don't know why this is like this. So to treat the multiple blocks, that means blocks more than 2 or more, like 3, 4, even sometimes more, then complex blocks, we have 2 methods of treatment. One is angioplasty and stenting, where a small stent, a metallic mesh-like thing is put inside the blocked artery. The other method is bypass operation, where arteries or veins taken from other part of the body, like from the leg of the patient, or an artery taken from inside the chest and is connected to the coronary artery or the artery of the heart beyond the block. So there is a matching in the tissue to tissue, that is, we are using the same tissue, that like a blood vessel taken from other part of the body, unlike stenting where a metal piece, a foreign body is kept inside the artery of the heart, which can give rise to reblock and blood can clot inside this thing and give more problems. So the best treatment, the medical research has shown us that the best treatment for patients with the multiple blocks, then patients with the young age, patients having left main coronary artery, that is the main artery itself blocked, patients with the diabetes, then patients with the diabetes and lower pumping power. These are all the subgroup of patients who benefit more from the bypass operation than the stenting or angioplasty. So in nutshell, what I want to tell you is that if you want to live longer life, like 20 years or more, 20 to 25 years after a block occurred in your heart artery or coronary artery and heart attack, it is better you go for bypass operation than the angioplasty and stenting, where definitely the longevity of life is less, like 2 to 3 years. By the time they develop problems like restenosis or again block coming over the stent, or they are going for heart attacks, or they go for more complications like kidney failure and other problems, in the body due to the lot of medicines given for keeping the stent patent, what is known as a stent to go in a good healthy condition. Whereas in bypass operation, these medicines are given in a small doses, so the complication rates and the other organ damage like a kidney damage are much less, and the long life is there, like 20 years or more. If you want to live after a heart attack or block in the heart, the best treatment is bypass operation. Nowadays, these bypass operations are done in a very sophisticated way, and the complication rates like kidney failure or stroke or wound healing problem are less, and the long life is very good.